Welcome back again. Okay, today let's discuss about the anatomy of the liver. So the liver is the largest gland in our body, as well as it is the second largest organ next to the skin, and it's also the largest visceral organ in human being. So the liver is located in the most of the parts are located in the right hypochondriac region and in the epigastric region, in the superior aspect of the epigastric region, and some parts of the left lobe even extends up to the left hypochondriac region. So the liver this has many importance, including metabolic activities, as well as it is important as a accessory digestive organ. So as accessory digestive organ, the liver produce bile, which is important for emulsification of fat, as well as it store glucose as a form of glycogen. The liver has two surfaces. One is the diaphragmatic surface, which has the dome shape and which is smooth. And from the inferior aspect, there is a visceral surface. So in the visceral surface, there are different indentations and the fissures. So from the anterior or from the diaphragmatic surface, the diaphragmatic surface of the liver is covered by the visceral peritoneum, except the bare area of the liver, which is attached to the diaphragm. So anteriorly, the diaphragmatic surface of the liver is attached to the anterior abdominal wall by the falciform ligament. And after the falciform ligament, it will just divide it into two ligaments, which are the anterior coronary ligaments, which are also just a reflection of the peritoneum from the diaphragm. So this is the left anterior coronary ligament, and this is the right anterior coronary ligament. And posteriorly also, similarly, there is a reflection of the peritoneum, which are posterior coronary ligaments. This is the left posterior coronary ligament, and this is the right posterior coronary ligament. So the junction between the anterior and the posterior coronary ligament forms the triangular ligament. So this is the left triangular ligament, and this is the right triangular ligament. So the space between the anterior and the posterior coronary ligaments forms the bare area of the liver, which attached to the diaphragm, and it is not covered by the visceral peritoneum. So let's see the visceral surface. From the visceral surface, there are different indentations of the liver. For example, this one is the part of the liver which attached to the colic flexure of the large intestine, as well as the transverse colon, the right part of the transverse colon attached to here. And here is the indentation for the right kidney as well as the right suprarenal glands. And here is most part of the left lobe is related to the stomach, and some parts, small parts around 2 centimeters, is related to the duodenum, the superior aspect of the duodenum. And in the inner side, these indentations just form the letter H. So this letter H is formed by the two vertical bars and the horizontal bar. So the first one, this is the right bar, is formed by the right sagittal fissure. Okay, the right sagittal fissure is formed by anteriorly by indentation for the gallbladder. It has been just occupied by the gallbladder here, and posteriorly it is by the indentation by the inferior vena cava. It forms the right sagittal fissure, and this is the left sagittal fissure. The left sagittal fissure is formed by anteriorly by the round ligament of the liver, or the ligamentum teres, which is the remnant of fetal umbilical vein, which carries blood from the placenta to the fetus. And this is the posteriorly, it is formed by the ligamentum venosa, which is the remnant of. So this is the right sagittal fissure, and this is the left sagittal fissure. So the right sagittal fissure is formed by the indentation for gallbladder as well as for the indentation for inferior vena cava, and the left sagittal fissure is formed anteriorly by round ligament of the liver or ligamentum teres, and posteriorly it is formed by ligamentum venosum, which is the remnant of ductus venosum. And the horizontal bar of the edge is formed by the porta hepatis. The porta hepatis is where the structures, the neurovascular structures exit and enter into the liver through the porta hepatis. So the visceral lobe of the liver is intraperitoneal except the porta hepatis where neurovascular structures exit and enter, and as well as for the indentation for the gallbladder, which is just found posterior to the gallbladder. These are not covered by the visceral peritoneum. The other parts of the visceral liver is covered by the visceral peritoneum. So the visceral surface of the liver is also attached to different structures. For example, the liver is attached to the stomach with the lesser omentum, and the lesser omentum just has the thickening which attached the liver to the duodenum, which is called the hepatoduodenal ligament. So in the hepatoduodenal ligament, the portal triads are just covered by the hepatoduodenal ligament. So the portal triads are the hepatic artery. This is the hepatic artery, this is the portal vein, and this is the bile duct, okay, the bile duct. So these are the portal triads. So these portal triads just pass through the hepatoduodenal ligament, which is the thickening of the lesser omentum. So the lesser omentum, in general, it's attached the liver to the lesser curvature of the stomach. There are two types of classification. One is anatomical classification, the other is the functional classification. So according to anatomical classification, the liver can be classified as the right lobe of the liver and the left lobe of the liver by the falciform ligament from the diaphragmatic surface, and posteriorly by the left sagittal fissure, which is formed anteriorly by the round ligament of the liver, as well as posteriorly by the ligamentum venosum. And sometimes the posteriorly, these are just called the caudate lobe and the quadrate lobe are considered as the accessory lobes, but technically in the anatomical classification of the liver, the caudate lobe and the quadrate lobe are classified as the right lobe of the liver. So according to the anatomical classification, the left lobe is much lower or smaller than the right lobe, which is around 1/6 of the total lobe. And the other is the functional classification. Okay, so the functional classification of the liver is based on the portal triads, which gets and exits through the porta hepatis. So the liver, almost the entire part of the liver gets its primary portal triads either from right or left, except the caudate lobe, which is considered sometimes as the third lobe of the liver, okay, which gets its portal triad from both right and left, as well as it drains its venous drainage into the inferior vena cava independently. So we have the right and left lobe of the liver based on the right sagittal fissure in the visceral surface, and on the diaphragmatic surface by the canthal line, which passes which connects the inferior vena cava and the fundus of the gallbladder. Okay, this is called the canthal line. So according to this classification, this is the left lobe and this is the right lobe, so which have similar size, almost actually it is not exactly similar, but it is somehow comparable, so they have the comparable size. So according to this classification, For example, we have said this is the left lobe and this is the right lobe. So according to the functional classification, the portal triads, just after getting into the porta hepatis, they will divide into right and left. For example, if you see this is the portal vein, so the portal vein will divide into left portal vein and right portal vein. So the right portal vein will supply the right lobe, the right primary lobe, and the left part will supply the left primary lobe of the liver. And the artery also similar. There is a hepatic artery getting into the porta hepatis. So the hepatic artery will divide into right and left. So the right hepatic artery supply the right functional lobe of the liver. The left hepatic artery supplies the left functional lobe of the liver. And the bile drainage also similar, meaning the left lobe of the liver drains into the left hepatic duct, as well as the right lobe of the liver drains into the right hepatic duct. So further, the liver have just two. Now we have said that the liver have two primary lobes, the right lobe and the left lobe, by the canthal line in the diaphragmatic surface, as well as by the portal fissure, or by the right sagittal fissure in the visceral surface. Okay, and further these primary lobes will be divided into secondary lobes by the umbilical fissure and by the right portal fissure. Okay, the umbilical fissure is just in the visceral line by the left. This is the left portal fissure, or which is formed by anteriorly by the round ligament of the liver, as well as by the ligament of venous and posteriorly. Okay, and in the diaphragmatic surface by the falciform ligament. So it just divided into the medial and lateral. This is the left lobe. So the left lobe will further divide into the left medial and the left lateral lobe of the liver. Okay, so here is the right lobe, just after the canthal line. This is the canthal line, already I have told you. So this is the right lobe. So the right lobe also further will divide it into two, the medial and the lateral, but it doesn't have any landmark or any indentation on the diaphragmatic surface. Okay, so this is the right lateral and this is the right medial. So these are the secondary lobes. So how many secondary lobes do we have? Just this was the left primary lobe, this is the right primary lobe. So the secondary lobe will just further the medial and the lateral. So we have the secondary lobes in the left side, as well as two secondary lobes in the right side. So just in the right side we have the medial, the right medial, and the right lateral lobe. And in the left side similar, we have the left medial and the left lateral. So further there is a transverse portal fissure, which just further divide the right. This is the right lobe, yeah? The right lobe just will divide by the transverse portal fissure into upper and lower. So just these are the tertiary lobes. So the right lobe, how many tertiary lobes are there in the right lobe? There are 1, 2, 3, 4. That means the medial lobe will divide into upper and lower, superior and inferior, independent tertiary lobes, as well as the lateral lobe also will just divide into superior and the inferior. So we have 1, 2, 3, 4 tertiary lobes in the right lobe. And in the left lobe, unlike to the right lobe, the left medial lobe remain as it is. It doesn't just, it will not just divide into right and, into the superior and inferior further. But the left lateral, similar to the right lobe, it will divide into superior and inferior lobe or tertiary lobes. So we have two tertiary lobes, independent tertiary lobes in the left lobe, and we have 4 independent tertiary lobes in the right lobe. So we have around 6 independent tertiary lobes in the liver. And this, the secondary lobes will count as it is. And there is also the caudate lobe. So the caudate lobe of the liver will consider as the first lobe. We have totally we have 8 lobes, okay? So this is the first lobe, and this is the second, okay, and this is the fourth, this is the sixth, the medial, okay, the medial, the secondary lobe considered as the single independent lobe, so it is the fourth, and this is eighth. So these are just numbered in Roman number, and each tertiary lobes will just have their own blood supply. So what is the clinical importance of just knowing these segments or this tertiary lobe of the liver is that in clinical practice, understanding the liver segments is very important because the liver is divided into independent functional units, as we have seen. Each segment has its own blood supply and its own biliary drainage. This means that when a patient has a tumor, abscess, trauma, or any localized disease, surgeons can remove only the affected segment without damaging the rest of the liver. So knowing the segments also help radiologists and clinicians accuracy describing the location of the abnormalities on ultrasound, CT scan, or MRI. So segmental anatomy of the liver allows safer surgeries, precise diagnosis, and better treatment planning for the liver disease. Thank you for watching. See you in the next video. Bye-bye.